G'day folks, Dr. Liam Cartwright here. I've been working in men's health for over 30 years now, and today we're going to talk about something that might make some of you blokes a bit uncomfortable. But trust me, after 3 decades of seeing patients in my Sydney clinic, I reckon this conversation could literally save your life. Here's something that might surprise you. Just last week, I had an 82-year-old patient tell me he's been masturbating daily since retirement. His wife sometimes lends a hand, and he feels bloody fantastic. And you know what? That's exactly what I want to hear, because self-pleasure isn't just for young fellas. It reduces stress, improves sleep quality, boosts circulation, and supports your prostate health. For many older gents, it's about rediscovering intimacy, finding relaxation, and practicing genuine self-care. But here's the kicker, and this is where it gets serious. I've also seen blokes in their 70s and 80s who've unknowingly damaged their prostate, wrecked their pelvic floor, and even accelerated cognitive decline, all because of 5 critical mistakes they're making. And the worst part? Most of these men have no idea they're doing anything wrong. So if you're over 70, or you've got a father, grandfather, or mate who is, I need you to pay attention for the next 15 minutes. Because what I'm about to share could make the difference between enjoying your golden years with vitality and struggling with problems you never saw coming. Now, before we dive in, let me ask you something. Have you ever wondered whether your body still works the same way it did when you were younger? Of course it doesn't, right? Your knees aren't what they used to be. Your eyes need reading glasses. You can't eat a meat pie at midnight without paying for it the next day. Your body's changed, and that's completely normal. But here's what's interesting. I see so many older men who've adapted to these changes in every area of their life except one. They're still approaching masturbation with the same speed, intensity, and techniques they used in their 20s. And mate, that's where things go pear-shaped. Let me paint you a picture. Your cardiovascular system's slowed down a bit. Your testosterone levels aren't what they were 40 years ago. Your pelvic floor muscles, yeah, blokes have them too, aren't as strong as they used to be. But are you adjusting your habits to match? Most of you aren't, and that's creating problems you don't even realize exist yet. Right. Let's get into the 5 mistakes. And I'm telling you straight up, if you're making even one of these, you need to stop today. Mistake number 1, speed and intensity that your body can't handle anymore. Look, I get it. When you were a young bloke, you could go hard and fast, finish in a few minutes, and be right as rain. But your body's different now. Your blood vessels aren't as elastic, your nerves don't fire as quickly, and forcing the same aggressive rhythm you used decades ago, that's putting unnecessary strain on your cardiovascular system. I had a patient, let's call him Barry, 7'3", from Bondi, who came to me with chronic pelvic pain. Couldn't work out why. After a frank conversation, turns out Barry was still going at it like he was training for the Olympics. The aggressive motion was creating micro tears in his pelvic muscles, leading to chronic inflammation. Here's what I told Barry, and what I'm telling you. Slow down. I mean it. A slower, gentler rhythm isn't going to make you less of a man. In fact, it's going to protect your prostate, reduce strain on your heart, and actually increase your enjoyment. You'll last longer, you'll feel more sensation, and you won't wake up the next morning with pelvic discomfort. Think of it like driving. When you were young, you might have thrashed your old Holden up the Pacific Highway, but now you take it easy, enjoy the scenery, arrive safely. Same principle applies here, fellas. Mistake number 2, relying on internet pornography, and this one's a bloody minefield. Now, I'm not here to judge anyone. What you do in private is your business. But I need to tell you what I'm seeing in my clinic, because it's getting worse every year. Many older blokes have turned to online porn without understanding the unique risks it poses, especially for your age group. And I'm not talking about moral stuff. I'm talking about your brain health, your heart, and your ability to function. Here's the science in plain English. When you watch pornography, your brain releases dopamine. That's the feel-good chemical. But when you're repeatedly exposed to highly stimulating pornographic content, and mate, modern internet porn is designed to be hyper-stimulating, your brain adapts. It starts needing more and more intense material to get the same dopamine hit. For older men, this creates a perfect storm. Your dopamine receptors are already less sensitive than they were when you were younger. Add porn addiction on top of that, and you're looking at serious consequences. Memory problems, difficulty concentrating, mood swings, and even depression. I had a bloke in here last year, we'll call him Frank, 6'8", retired from the mines up in Newcastle. Frank's wife had passed away a few years earlier, and he'd started using porn daily, sometimes multiple times a day. Within 18 months, His kids noticed he was forgetting appointments, seemed withdrawn, couldn't focus on conversations. They thought it was early dementia. Turns out, it wasn't dementia at all. It was porn-induced changes to his brain chemistry. We worked together to gradually reduce his usage, replaced it with healthier activities. He joined a lawn bowls club, started volunteering at the local library, and within 6 months, his cognitive function improved dramatically. Now, you might be thinking, Doc, I only watch it occasionally. No worries. But here's the thing. The constant flooding of your brain with artificial sexual imagery affects your memory, concentration, and mood, even with moderate use. What seems like a harmless private habit can slowly undermine your emotional resilience and mental sharpness. And let's not forget the physical risks. Many of my older patients have heart conditions, high blood pressure, or they're on medications. Getting overly aroused watching intense pornographic material can spike your blood pressure dangerously. I've had blokes end up in emergency because of it. Mistake number 3. Ignoring your pelvic floor muscles. And yeah, you've got them too. This is the one that surprises most blokes. You've heard of pelvic floor exercises for women after childbirth, right? Well, men have pelvic floor muscles too, and they're just as important. Your pelvic floor supports your bladder, bowel, and sexual function. As you age, these muscles naturally weaken. But if you're masturbating without any awareness of these muscles, you're potentially making the weakness worse. Here's what happens. If you're using excessive force or speed, you're creating pressure on already weakened pelvic floor muscles. Over time, this can lead to urinary incontinence, bowel problems, and erectile dysfunction. I'll give you a real example. A colleague of mine in Melbourne told me about a patient, George, 76, who started experiencing urine leakage. George was embarrassed, stopped going to his weekly golf game, avoided social situations. Turns out, years of aggressive masturbation combined with never exercising his pelvic floor had created severe muscle weakness. The good news? This is fixable. I taught George some simple pelvic floor exercises. They're called Kegel exercises, and they're dead easy. You just squeeze the muscles you'd use to stop urinating, hold for 5 seconds, release, and repeat. Do this 10 times, 3 times a day, and within a few months, George's symptoms improved significantly. During masturbation, try to stay aware of these muscles. Don't strain or push. If you feel tension in your lower abdomen or pelvis, you're probably doing it too hard. Ease up. Take your time, and consider adding pelvic floor exercises to your daily routine. Mistake number 4, not using lubrication, and this is a big one. All right, let's talk about something most blokes don't think about until it's too late: friction. When you're younger, your skin's more elastic, you produce more natural moisture, and you can get away with dry masturbation. But as you age, your skin gets thinner and more fragile. Using lubrication isn't just about comfort, it's about protecting your skin from tears, preventing irritation, and reducing the risk of infection. I've seen older men develop chronic skin conditions, painful fissures, and even bacterial infections because they weren't using proper lubrication. And here's something crucial. If you're on certain medications, and let's face it, most blokes your age are on something, your skin might be even more sensitive. Blood thinners like warfarin can make you bruise and tear more easily. Medications for prostate issues can cause dry skin. Using lube protects you. What kind should you use? Water-based lubricants are generally safest. They're easy to clean up, don't stain sheets, and don't interact with your skin's natural pH balance. Avoid anything with fragrances or harsh chemicals. Your skin down there is sensitive enough already. I had a patient last year, we'll call him Trevor, 7'1", who came in with painful lesions. He was embarrassed, thought he'd picked up an STI somehow. Turns out it was just severe friction damage from years of dry masturbation. We cleared it up with some topical treatment and a bottle of good quality lube, and Trevor's been fine ever since. Mistake number 5, ignoring what your body's telling you, and this is the most dangerous one. Right, this is where it gets really serious. As you get older, your body sends you signals when something's wrong: pain, discomfort, difficulty achieving or maintaining an erection, changes in ejaculation. These aren't just annoyances, they're warnings. Too many blokes ignore these signals. They think, oh, I'm just getting old, it's normal. But here's the thing, while some changes are normal, others are signs of serious health conditions that need medical attention. Let me give you a real scenario. I had a patient, we'll call him Dennis, 7'4", who'd been experiencing pain during ejaculation for 6 months. He didn't tell anyone, just powered through it, figured it was part of aging. When he finally came to see me, We discovered he had prostatitis, inflammation of the prostate, that had become chronic because it wasn't treated early. If Dennis had come in after the first month, we could have cleared it up with a simple course of antibiotics. Instead, he needed months of treatment, including pelvic floor physiotherapy and anti-inflammatory medications, all because he ignored his body's warning signs. Here's what you need to watch out for: any pain during or after masturbation, blood in your semen or urine, difficulty achieving erection when you previously had no problems, changes in the force or volume of ejaculation, a feeling of incomplete emptying of your bladder. Any of these symptoms? Get to your GP immediately. And while we're on the topic of medical issues, I need to address something that came up in the comments from a previous video. A woman mentioned her husband was prescribed tamsulosin. That's a medication commonly used to treat enlarged prostate, and it completely eliminated his ability to ejaculate. She was asking if there's a solution. This is a real issue, and I'm glad she brought it up because heaps of blokes are dealing with this. Tamsulosin and similar medications work by relaxing the muscles in your prostate and bladder neck, which helps with urination. But a common side effect is retrograde ejaculation. That's where the semen goes backward into your bladder instead of out through your penis. It's frustrating, I know. But here's what you need to understand. This isn't permanent damage. If you stop the medication, normal ejaculation usually returns. However, you shouldn't just stop taking prescribed medication without talking to your doctor. There are alternatives. Some blokes respond better to different alpha blockers like alfuzosin or silodosin. Others might benefit from a different class of medication altogether, like 5-alpha reductase inhibitors. Some men find that taking the medication at a different time of day reduces the side effect. And in some cases, surgical options like TURP or laser therapy can eliminate the need for medication entirely. The key is, have an honest conversation with your doctor. Tell them it's affecting your quality of life. A good GP will work with you to find a solution that treats your prostate symptoms without completely eliminating your sexual function. You shouldn't have to choose between being able to pee properly and having a sex life. We can often manage both. Now, before we wrap up, I want to talk about something that doesn't get discussed enough: the emotional and psychological aspect of all this. For many older men, masturbation isn't just physical. It's about maintaining your sense of vitality, your connection to your own body, your identity as a sexual being. When you've been with a partner for decades, when you've lost a partner, when health issues have changed your relationship, self-pleasure can be a way of maintaining intimacy with yourself. And there's no shame in that, none whatsoever. After 30 years in this job, I can tell you, the healthiest, happiest older men I see are the ones who've maintained a positive relationship with their sexuality, whatever form that takes. But, and this is important, that relationship needs to adapt as you age. Just like you've learned to adjust your diet, your exercise routine, your work-life balance, you need to adjust your approach to self-pleasure too. Think about intimacy differently now. It's not about speed or intensity. It's about connection. Connection to your own body, to sensation, to pleasure. It's about comfort without judgment. It's about finding what feels good for your body as it is now, not as it was 40 years ago. Some of my patients have discovered that taking more time, focusing on the journey rather than the destination, has actually increased their enjoyment. They're not rushing to finish anymore. They're savoring the experience, exploring different sensations, being present in their bodies. And you know what? That's exactly what I want for all of you. I want you to feel comfortable in your own skin. I want you to enjoy your bodies without fear or shame. But I also want you to be safe, to be healthy, to protect yourself from unnecessary harm. So here's what I'm asking you to do. Take a moment to honestly assess your habits. Are you making any of these 5 mistakes? If you are, make changes today. Slow down, ditch the porn, or at least cut way back. Start doing pelvic floor exercises. Buy some proper lubricant. And most importantly, listen to your body and see a doctor if something doesn't feel right. Your health matters, your comfort matters, your dignity matters, and you deserve to enjoy your sexuality safely, healthily, and on your own terms for as long as you're able. Look, I know this hasn't been an easy conversation. It's not exactly the kind of thing you chat about over a beer at the pub, but it's important, and I'm glad you've stuck with me through it. If you found this helpful, do me a favor. Hit that like button so I know you want more of this straight-talking health advice. Subscribe to the channel if you haven't already. I post new videos every week covering all aspects of men's health. No topic off limits, no judgment, just facts and practical solutions. And here's the thing. I know there are heaps of you out there dealing with similar issues, but too embarrassed to talk about them. If you've got questions, drop them in the comments below. You can stay anonymous if you want. I don't need to know who you are. I just want to help. I read every comment, and I often make videos based on your questions. Maybe you're dealing with medication side effects like that tamsulosin issue we discussed. Maybe you're experiencing symptoms you're worried about. Maybe you just want to know if what you're experiencing is normal. Whatever it is, ask. I guarantee there are dozens of other blokes wondering the same thing, too afraid to speak up. And if you've got a mate, a father, a grandfather who might benefit from this information, share this video with them. I know it's awkward, but you might be helping them avoid serious health problems down the track. Sometimes the most caring thing we can do for the men in our lives is start uncomfortable conversations. Remember, getting older doesn't mean giving up on pleasure, intimacy, or vitality. It just means approaching these things with wisdom, care, and respect for the body you've got now. You've earned every one of those years, every one of those experiences. Your body's carried you this far. Treat it well, and it'll keep serving you for years to come. Thanks for watching, folks. Take care of yourselves, and I'll see you in the next one.